Hello guys, we are going to look at one disease of the heart, the disorder of the myocardial blood supply. The disorder of the myocardial blood supply. The heart supply all body parts via the artery, including the heart. The heart is supplied by the coronary arteries. When the coronary artery the heart is supplied by the coronary artery. This supply makes the heart to be viable and allow for contraction and relaxation of the heart. When the heart contracts, blood is supplied to all parts of the body. When the heart relaxes, blood is returned into the heart. The coronary artery is supplied by the heart. There are some diseases that affect the blood supply of the heart muscles or to the heart muscles. These diseases include the coronary arteriosclerosis, angina pectoris, and myocardial infarction. They include coronary arteriosclerosis, angina pectoris, and myocardial infarction. The coronary arteriosclerosis occur when the blood vessels that is supplying the heart is narrowed. This narrowing of the blood vessels may be caused by fat in the wall of the blood vessels in form of blood clot. Blood clot can affect the blood flow to the heart muscles. Blood clot, fat deposit, the infection can cause the blocking or occlusion of these blood vessels. When the blood vessels supplying the heart is occluded, this results to lesser blood or no blood perfusing the heart muscles, resulting to ischemic heart disease. When there is ischemic heart disease, the coronary heart disease, when there is ischemic heart disease, it affects the blood flow to the heart, and this usually leads to heart failure. The heart failure could be left-sided or right-sided or both. When the heart failure is right-sided, it means there is a problem with flow of blood to the pulmonary circulation. From the pulmonary circulation, the blood will move to the left side, and from the left side it will go to the system. The next one is the angina pectoris. Another name for angina pectoris means chest pain. Angina pectoris. Ischemic heart disease results to angina pectoris. Pain in the chest. This pain in the chest occurs when there is congestive heart failure, or when there is pulmonary congestion. In case of pulmonary congestion, that's in the case of right-sided heart failure, there is usually cough, weakness, breathlessness, or difficulty in breathing, fatigue or tiredness. There are different types of angina pectoris, 4 types of angina pectoris. We have stable angina pectoris, unstable angina pectoris, and microvascular angina pectoris. For stable angina pectoris, this occurs within a very short period of time. It is also known as acute angina pectoris. It is sudden, and this is not usually noticed. For unstable angina pectoris, it is common for patients that have been treated of angina pectoris previously, and this occurs in patients for a very long period of time. The onset is within months and years, 6 months and years. The unstable angina pectoris usually results to myocardial infarction or heart failure. Then we have variant angina pectoris. By variant angina pectoris or prince-metal angina pectoris is a type of unstable angina pectoris, which usually occur for a very long period of time. This also can result to heart failure, breathlessness. This occurs as a result of, can be from drugs, narrowing of blood vessels, the chemical substance that make the blood flow to the coronary arteries to be blocked. The 4th type is the microvascular angina pectoris. Microvascular, that is tiny blood vessels. The blood vessel is too tiny and is not allowing the flow of blood to the coronary artery. The blood vessel is too tiny and it is not allowing the flow of blood to the coronary artery. It is not necessarily as a result of disease, but it occurs. The microvascular angina pectoris is as a result of tiny nature of the blood vessels. Myocardial infarction occur when there is heart failure, when the heart is unable to function properly. This occurs mostly as a result of arteriosclerosis, which may come from thrombosis or embolism. This lead to heart failure. When the blood vessels are narrowed, it results to heart failure. The management of disorders of myocardial blood supply include diagnostic. The first one is the medical management, the diagnostic. Investigation should be made to check the causes of the diseases. The history of the signs and symptoms, the presenting signs and symptoms is very important. The history of the presenting signs and symptoms is very vital. The medical treatment include the drugs such as anticoagulant, e.g. warfarin may be prescribed by the doctor. Aspirin may also be prescribed by the doctor. The antibiotics may be given in combination to treat infection if the failure is as a result of infection. In case of thrombophlebitis, antihypertensive may also be prescribed. Radiological treatment like X-ray to dictate the blood vessels that is or are occluded. The nursing management include vital signs, regular vital signs, especially the pulse and the blood pressure is very important. Administration of drug, that is prescribed. The health education, give health education to the patient, including lifestyle, avoiding lifestyle such as smoking, sedentary lifestyle, avoiding eating food that is high in fat. Thank you for listening. Like my channel, subscribe, make comment, or you are free to ask any question. Bye.